Namaste viewers and friends, a very warm welcome to a new video in the Ayurvedic herbal series, and today we are going to talk about the chronic kidney disease or the kidney disorders. I won't be able to cover all the different kind of kidney disorders, but I would be focusing morely on the chronic kidney disease. Chronic kidney disease includes conditions that damage your kidneys and decrease their ability to keep you healthy by filtering waste from your blood. So, essentially, if your kidneys are not working properly, then the filtration would not happen. Your blood will not be filtered, and all the metabolic waste and the poisonous, toxic substances would be mixed in the blood, and that's going to harm your body in a big way. So, if kidney disease worsens, waste can build up to high levels in your blood and make you feel sick. And you may develop complications like high blood pressure, then anemia, which is the low blood count. Then you might have weak bones and joints, and poor nutritional health and nerve damage as well. So kidney disease also increases your risk of having heart and blood vessel diseases. These problems may happen slowly over a long period of time, and a lot of people would not be able to diagnose their kidney failure or the kidney issues, and they would be surprised to find out that they are already in the second or the first stage of their CKD. So the only best treatment is the early detection, which can often keep chronic kidney disease from getting worse. And having said that, it would mean that you need to be aware of your body, you need to observe the symptoms, you need to have a healthy lifestyle, and if you experience the slightest of imbalance in your body related to any organ system, you need to go and do a routine body checkup. I normally advise people to do the routine body checkup once in 6 months or at least once in a year, full body checkup. However, if you experience any discomfort or persistent symptoms, then you should not avoid it. Ignorance is sin when it comes to health, and you need to give due attention to your body. And when you get pain or any symptom, it means your body is trying to speak to you that something is not going right and you need to fix it. When kidney disease progresses, it may eventually lead to kidney failure, which requires dialysis or kidney transplant to maintain life. Now, let me talk about what are the main causes of chronic kidney diseases. Well, diabetes is the most important trigger. If you have been going through diabetes and you haven't been maintaining your diabetes regularly, then over the period of time, you may land up into CKD, which is chronic kidney disease. And the other villain is the high blood pressure or hypertension. And it is spreading like a epidemic these days. These two diseases are lifestyle disorders, but they are so prevalent, especially in my country, in India. So these two are primarily responsible for two-thirds of the chronic kidney disease cases which we are finding these days. Well, what are the other conditions that affect the kidney? There are few other conditions or circumstances that can cause the kidney disease. I would say the glomerulonephritis is a group of diseases that causes inflammation and damage the kidney's filtering units. These disorders are the third most common type of kidney disorders of the disease, which can eventually lead to CKD. Then there are certain inherited diseases like polycystic kidney disease, or the PKD is a common inherited disease that causes large cysts to form in the kidneys and damage the surrounding tissue. The next is kidney and urinary tract abnormalities before birth, malformations that occur as a baby develops in its mother's womb. For example, a narrowing may occur that prevents normal outflow of urine and causes urine to flow back up to the kidney. This causes infections and may damage the kidneys. Next is autoimmune diseases. When the body's defense system, which is your own immune system, turns against the body, it's called an autoimmune disorder. Lupus nephritis is one such autoimmune disease that results in inflammation or swelling or scarring of the small blood vessels that filter waste in your kidney and take it out of the body. So now, what are the symptoms of chronic kidney disease? So most people may not have any severe symptoms until their kidney disease is in the advanced stage, maybe in the second or third stage. However, you may notice that you may feel more tired than normal and have less energy. You're always fatigued and you have trouble concentrating, you have trouble sleeping, and you have a poor appetite, you have a muscle cramping at night, and you have swollen feet and ankles. There's a puffiness around your eyes, especially in the morning, and also in the lower extremities like your ankles and your joints and your feet. You have dry and the itchy skin. You need to feel like urinating more often, especially at night. Your urine output can get reduced. And the range of symptoms depend on how it is manifesting and what stage it is. Well, what is the Ayurvedic perspective on CKD? The conventional approach of management includes dialysis and renal transplantation, which are not affordable options by most of the Indian population and even around the world, mainly due to the economic reasons and discomfort. I mean, both these dialysis and kidney transplantation cost a lot, and a lot of poor people and a lot of people who are in the median range of income won't be able to afford these two procedures. Therefore, exploration of a safe and alternative therapy is highly needed, which proves to be helpful in reducing the requirement of dialysis and is postponing the renal transplantation. Well, Ayurveda comes with a different and specific approach to chronic kidney disease. As discussed above, the cause lies with the Rakt or the Meda Dhatu. Rakt means basically the blood, and the Meda is the adipose tissue, which eventually vitiates the Vat, Pitta, and Kapha dosha, resulting in this disease. Hence, pacification of these doshas helps to treat the diseases quite effectively. I would say that kidney disorders are known as the Vrik dosha in Ayurveda, Vrik dosha. And primary dosha involved is Vat impairment, followed by Kapha, which blocks the bodily microchannels known as srotas. Well, according to Ayurveda, CRF or the chronic kidney disease is a disease of Mutravaha srotas, means connected to urinary system. Though all the three doshas are connected here, the doshyas are involved in the disease. Doshyas are the ones who are causative factors or the causative vitiation of the doshas. Kapha is responsible in blocking the micro vessels and developing microangiopathy, and Vata is responsible for degeneration of the structure of the kidney. According to Ayurvedic principles of management of the disease, the tissue damage can be prevented and repaired by rasayana drugs because they have the capability to improve qualities of tissues and hence increase resistance of the tissues. On the other hand, blockage can be removed by lekhana drugs having scraping effect on the blocked channels. Now let's look into a few of the prominent herbs which are used for chronic kidney disease. I would focus first on the combined Ayurvedic preparation, which are known as specialized formulation, and then I would go on few standalone herbs. Well, the first is Gopsharadi Gugulu, which is basically a compound or rasayana for Mutrava Strotra, and it is also a lekhana scraping. It also produces lekhana scraping effect because of Gugulu. The next is the Varunadi Kvat, which is also helpful to relieve the Kapha and the Vata doshas, but it also helps heal diseases that are associated with excess lipid production as well. So Varunadi Kvat is a diuretic, lipolytic, and the anti-inflammatory medicine. Then next is the Rasayana Churna, has properties which can be compared to rejuvenative and tonic. It acts as a rejuvenative, it raises immunity level, it lowers the risk factors of cardiac and the kidney disorders. It promotes elimination of toxins through urinary system, strengthens body's internal defense mechanism. Well, apart from these standard formulas or combinations of Ayurvedic herbs for CKD, there are some standalone herbs which can be used effectively patient to patient and case to case. The first one which I would like to discuss here is Punarnarva. Punarnarva plant may be helpful in kidney disorders like irregular blood pressure and diuresis. The plant extract is widely used for flushing out the kidney toxins as principally being used as diuretic. The extract of the plant as a powder and aqueous decoction may be used to aid management of nephrotic syndrome. Also useful in weight loss, eye disorders like glaucoma. Next is Kasni. Kasni or the chicory is well-known coffee substitute. A lot of people consume it, but very few have this knowledge that it has various nutritive properties. It is beneficial in liver kidney disorders, constipation, gallbladder stones, low agni, and digestive issues. The next herb is Apamarga, which is rich in flavonoids, tannins, saponins that help maintain the overall health of an individual. It pacifies Vata and Kapha, very effective action on digestive system, like it cures indigestion, renal calculus, which are nothing but kidney stones and piles. Next is Shigru. It is a powerful antioxidant herb, good for cardiac and the circulatory system and reduces hypertension. It also has antifungal, antiviral, antidepressant, and anti-inflammatory properties. And it has basically high levels of antioxidants that reduces toxicity levels in the kidneys. So let's talk about certain foods which should be avoided in chronic kidney disease and different chronic kidney disorders. I would say instead of start picking up the foods and avoiding foods, you should actually first ascertain your medical condition, your blood work and all your reports. You need to check out your creatinine level, urea levels in your blood, and also the levels of sodium, potassium, and phosphorus. Because normally, when you have CKD, there would be an issue of fluctuations of these parameters, especially for potassium, phosphorus, and sodium. And also, you need to check the blood sugar as well if you're also diabetic, if you have been diabetic, because CKD actually gets triggered because of the chronic diabetes and hypertension. In almost 85 to 90% of cases, it has been observed. So the amount of potassium needs to be checked, and the potassium plays a very vital role in the chronic kidney disorders. And the potassium in the blood is also controlled by the kidneys. So for people with kidney disease, the potassium levels can build up to high, and this can also lead to a lot of complications. This condition is known as hyperkalemia and can be dangerous for the heart. Well, risk of high potassium levels in CKD can also cause problems such as weakness, muscle cramps, tiredness, irregular heartbeat, and even heart attack. So, what to avoid in CKD when it comes to potassium? I cannot actually go into individual food items because that would make this video too long, and also it is beyond the scope of this video. If you are going through a CKD and you want a consultation, then I provide a holistic health consultations where I include a holistic approach and look into all the details before recommending you the Ayurvedic herbs, yoga therapy, and the diet plan. So I really cannot go in that kind of a detail here, but I'm just touching the subject for the information and knowledge, so that you understand your problem if you're going through it. Well, you need to avoid the whole grains, then chocolates, nuts, and seeds, then beans, dairy products, and fish, particularly if you have high potassium level in your blood. But there would be certain exceptions. As I said, you have to design an Ayurvedic diet for chronic kidney disease patient, depending on the different reports and the profile. Then another thing that you have to watch out for is the phosphorus level. Phosphorus is also a mineral we get from eating certain foods. Phosphorus helps build strong bones and teeth. It also helps convert food into energy and helps with metabolism. Now, normally kidneys release extra phosphorus into the urine. However, in kidney disease, the kidneys can actually prevent the body from getting rid of buildup that causes problems for the bones and heart, and it can also increase phosphorus levels. So most high potassium foods come from the plants like fruits and vegetables, which tend to be high in potassium sources. However, there are certain exceptions, so you need to actually your Ayurvedic therapist or your doctor or your nutritionist need to actually sort out the foods which comes in the exception list, and then take out the foods which are in the list which should be avoided. Now, high protein foods as well, such as meats, along with the dried beans, legumes, and peas, tend to be high in phosphorus. Apart from that, you should also avoid starchy vegetables like potato, yam, corn, beetroot, and spinach. Then the other group of food items which you should definitely avoid are green leafy, but not all green leafy. However, most of the green leafy are high in phosphorus. So you should avoid spinach, broccoli, especially cooked ones, and then even cucumber can be avoided. So apart from this, if you have a hypertension issue, even if you don't have hypertension, if you have a CKD, then you should also watch out for the sodium content in your blood. So prepare food with less salt and sodium to control hypertension, because that would lead to different sort of complications. As I said, avoid starchy, sugary, and milky foods as well as dairy, especially if you have diabetes too, along with CKD, which is quite common in most of the CKD cases, that people are also having diabetes. So what you should do other than the diet and herbs is that you should maintain a healthy lifestyle. And when it comes to healthy lifestyle, I can't emphasize more on the yoga therapy. So you need not to do any strenuous workout like cardio or heavy weightlifting. No, that's totally a big no for patients with diabetes, hypertension, or even with CKD. You should go for regular brisk walk, 20-30 minutes in a day, along with some specialized yoga therapy sequence, which should be done under the supervision of a yoga therapist who is not only experienced but also knowledgeable. And there are certain asanas and pranayamas and breathing exercises and meditations that would really help you to normalize your blood pressure, especially in case of hypertension and also diabetes. These asanas and pranayamas actually create a surge of a pranic force in certain marma points, which are also known as the pranic meridians, and open up those blockages which are causing the problem. And also once those blockages are cleared, then the energy can freely flow in those organs, and it improves the blood circulation there, and this is how the healing happens. Last but not least, stress. A lot of people with CKD would have stress as an issue, especially people who are already having a hypertension. They should avoid stress, because stress would only complicate the problem. Stress kind of obstruct the healing process, because it obstructs the natural flow of prana. So you should avoid stress. You should have a healthy lifestyle. Watch out your daily schedule, like sleeping on time and waking up on time, and then having a realistic goals and targets. And if you are going through CKD, then you don't have to worry unless your chronic kidney disease has led to a renal failure where it has reached the 4th or 5th stage, where dialysis is the only option. Otherwise, all stages of CKD can be cured and reversed. However, you need to have a lot of positivity and a strong willpower to follow the diet plan and to take the Ayurvedic herbs, along with healthy lifestyle, including yoga therapy. So combination of all these things would actually help you to cure and treat your chronic kidney disease and become healthy once again. As I said that I provide holistic health consultations for most of the chronic disorders, including the CKD. So if you are going through it, then you don't have to be dejected and pessimistic about it. Take control of your life, take control of your health by taking the right actions at the right time. So this is all I wanted to share with you guys about chronic kidney disease. Hope you liked the video. If you liked it, then don't forget to subscribe and like the video and subscribe the channel so that you can keep getting updates of similar videos which we'll be uploading from time to time now on. Thanks a lot. Namaste. I'll see you in the next video.
For more such informative videos on yoga and Ayurveda, subscribe to our YouTube channel and press the notification bell. Thank you.